Hi, my name is Amanda Troger. I am a nurse in the Allergy and Immunology Department here at Children's National Hospital. I'm a certified pediatric nurse, a certified asthma educator, and have my master's in nursing education. For the past 10 years, I have worked in the allergy clinic caring for patients who come in with different allergic conditions, such as asthma, eczema, and food allergies. Now today, we're going to be discussing the 4 different auto-injector devices that are currently on the market for treatment of food allergy or other anaphylactic reactions. Let's get started. So Teva is a generic epinephrine auto-injector that is relatively new on the market. It is a device that is long and slender, and it is one of the devices that we can use for administering epinephrine auto-injector, administering epinephrine. The way to use this device is you hold it in a fist. You want to hold it with all of your fingers touching. It's very important not to put your finger on the top or the bottom. This is critical for all of the devices that you'll be learning about today, as you don't want to accidentally stick yourself instead of the child or other individual who may need the medication. Once you go to use the medicine, you want to twist off the bottom. You're then going to release the safety. Now, a good mnemonic to think about is blue to the sky, orange to the thigh. And this is really useful for all the devices we'll be talking about today. So blue to the sky, orange to the thigh. We're going to take off that blue. So you just flick it off with your thumb. You put that to the side. And then you're going to push the orange part into the thigh. Now this is where the needle will be coming out, so you want to make sure that you are clear. It's good to have a nice, good, firm grip on the thigh. The injector will always be administered in the upper outer portion of the thigh. The best place is right here on the upper outer, right where you can see when you're sitting. For children, many children have difficulty staying still, they're nervous, they might be wiggling. It's recommended you want to hold a nice, good, firm hold on their leg. That way you have support and you can move with them in case they do try to move. So you're going to push that orange part down into the thigh until you feel and hear a click. Then you're going to hold the device for 3 seconds. 1, 2, 3. Now you release. There is a large orange portion at the top. We saw it before, but it's going to get a little bit bigger. This is called a safety. This protects you from that needle. For this device, you will never see or touch the needle. Once you use epinephrine, be sure to follow your action plan and call 911 to make sure that your child is able to get further care if necessary for the reaction. The next device we'll be talking about is Amul. This is Impact or just generic epinephrine. So you go to the pharmacy and you might see a device and it would come in a case. The way to get into the device is you're going to twist it and pull out the actual epinephrine auto-injector. Now the real device will be blue on the top and the bottom of this. And you can see that on one end, it's a little pointy. That's the needle end of the device. So you want to be cautious when you're working on that end of the device. The way to hold this one, again, is with a fist. And you want to keep your thumb touching your fingers. Now for this, you are going to release the safety cap for the bottom first, and then release the safety cap for the top. Once those are released, now you are ready to use the device. Again, you're going to do the same portion of the thigh, that upper outer portion. You're going to hold the leg firmly and place it against the thigh, and again, do a nice, good, firm push. You'll hear or feel a click, and this device you are going to hold for 10 seconds. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then you release. Now, one thing to note about this device is that the needle does not have a safety on the needle. So there is a small needle that will be at the top. So you want to be careful with that small needle. Make sure that you put it in a safe place and so that it does not stick any other individual in your home. When the ambulance arrives, you do want to let them know there's a live needle, it had been used, and they can dispose of it for you properly. For our next device, this is the EpiPen. This is the common one that most people know about. It's also the terminology that most people use when describing an epinephrine auto-injector. So our EpiPen, it also comes as a generic, which is just generic EpiPen. This device, again, you hold it in a fist. This, you have your blue to the sky and your orange to the thigh. So we will pull off the blue portion of the device, going to the sky. You're going to then place the orange portion against the thigh, that upper outer portion of the thigh. You push it down until you hear a click, and then you're going to hold for 3 seconds. 1, 2, 3, and then you release. As you can see, the orange portion does get larger on this device, so again, there is a safety to protect you against that needle. Now we call 911, and we make sure that the ambulance arrives so that we can get our further care. So the next device to talk about is Epiquiu. Now this device is a little bit different than the other ones that we spoke about today. And the reason is because it provides you with audio that talks to you step by step of how to use the device, where to place it, as well as how long to hold it against your thigh. So let's get started. So to use the device, you're going to put your fingers on the outside of the case, on the sides. You don't want to put it on the front and back. So you put it on the sides, you pinch the top, and you pull.
This trainer contains no needle or drug and is for training purposes only. Do not use this trainer during an allergic emergency.
This portion will not be part of the actual.
If you are ready to use, pull red safety guard down and off of this trainer. Place black end against outer thigh, then push firmly until you hear a click and hiss sound, and hold in place for 2 seconds. 2, 1. Training complete.
Once you have finished using the epinephrine auto-injector, the Epiquiu, you again want to call 911 and wait for ambulance to arrive so that you can go to the hospital for further monitoring. Thank you so much for listening to the episode of Bear Bites today. If you have any follow-up questions, feel free to leave them in the comments, or you can give my team a call at 202-476-3016. Thank you, and have a wonderful day.